Dr. Max at Maximal Wellness. Well, today we're going to show you how a chiropractor can work on the jaw, or the TMJ. Now, a lot of people will develop a popping jaw, or they'll get pain in the jaw from clenching, especially at nighttime if they're not wearing a mouth guard, dealing with a lot of stress, and that can lead to all sorts of problems like not being able to chew hard things like carrots or apples, or it can even get so bad you can hardly open your mouth at all. So when a chiropractor is evaluating a jaw, we do a few different things. First, we want to get a general assessment of how the jaw is moving. So I'll have you open and close the jaw a couple times for me slowly, please. And once more. So, kind of hard to see from your angle, but what I saw there is that his jaw comes down and then moves to the left. And down and moves to the left. So to me, that shows that we're dealing with some dysfunction and some of the muscles around the jaw are not working equal amounts to help depress, bring the mouth down, and that will affect things like chewing. So we're going to work inside the mouth first by helping to open up a couple of the muscles and relax what we call trigger points in the muscle spindles themselves. So trigger points are basically these little tender spots where there's like waste product that's been trapped, or the body has some sort of adhesion that's preventing it from moving. So this will be a bit intense. So as far as pain level, I want you to let me know when we get, say, more than a 6 out of 10. So first, we're working on this muscle called the masseter. What I want you to do is slowly open the jaw up and down like that for me. And I'm going to work through a couple of these points. So go for it. Open and close a few times. A lot of times people with chronic jaw issues are sleeping face down with their head turned to one side, or they're always asleep on one side. And we'll do one more right there. Next, we're going to go up to a tendon that's a little higher. This is the temporalis muscle. This muscle connects from the top of the jaw up to the side of the head here. When you clench your jaw, you can feel that on the side of your head around your temple. So same idea here. I'm going to have you open and close the jaw up and down. Yeah, these spots can be really tender. When I was in chiropractic school and we were practicing this on each other, keep going. Even in people that didn't have TMJ problems, some of these spots were painful enough to almost bring you to tears. But we call this therapeutic pain because we're helping to stretch and move this tissue that's been inflamed or locked up for a while and helping to increase range of motion, and that can help with pain and chronic tightness. Now we're going to go to a deeper muscle here, pressing a bit back at the top jaw there. That's pretty tender, isn't it? So sometimes I'll have people move the jaw side to side when we get to this muscle, but for Miguel here, I think this is tender enough that we're just going to apply some pressure here until I can feel this trigger point relax. Yeah. Yep, again, sometimes these spots can be so tender that we just apply some pressure and we don't worry about the pin and stretch. And relax. This last one, we're going to go on the bottom jaw. I'm going to go on the inside here. Slowly work our way in under the tongue. Let me know if you feel like you're going to gag a little bit. We can just change position. This one is here, the bottom of the jaw there. Doing okay. This one doesn't seem as bad to me. Let's have you move your jaw side to side. And as he's moving his jaw side to side, I can feel that sort of hitch in the jaw where things have been locked up. Will you open your mouth, please? We find that masseter muscle, and there's usually a couple good trigger points right around there. But yeah, this is the one that definitely has more wear and tear on it. So because of this, Miguel's probably starting to over-rely on the muscles on the left side of his jaw. But we'll see as we start to work through some of these other spots. Now we get to the temporalis, the muscle that comes here on the side, up to the side of the skull. So again, I'll have you open mouth up and down. People with a lot of tension in this muscle tend to get headaches on the side of the head. Now we're going to go for that deeper muscle. So this is sort of at the back of the upper teeth. Yeah, so I can see that he's been having to over-rely on the muscles on the left side because of the wear and tear here in the actual joint itself on the right. It's all about balance. or trying to find as much balance as we can. The last one is here, it's on the bottom jaw. So again, coming in, bottom teeth. We're going to slowly work our way down. If you feel like you need to gag, just raise your hand, okay? Because we're getting deep down here by the bottom of the jaw. So have you move your mouth side to side. And you can kind of see in the movement of his jaw how it wants to start and stop a bit because it's running over those muscles, trigger points, adhesions, and the wear and tear in the jaw itself. So now we get to do some adjusting here on the jaw. So I'll have you open and close this a couple times, about halfway, please. And close. And one more. And there. Hold right there. Close and open. I'm working on a couple different points. And close and open. That helps you increase mobility in the jaw itself. One more down here. So we're going to pause here, but we're going to do the same thing on the other side to get. So that is what it's like to get your jaw treated at the chiropractor. Now, because that was a lot of manual therapy on Miguel here, his jaw may be a bit sore later. Say that 5 times fast. So you'll want to use some ice on the jaw. Just about 5 minutes. That tissue is really superficial. It's just under the skin, so it doesn't take very long, but that can help to calm down the inflammation and feel better. But how's the jaw right now? Is it feeling different there?
Yeah, it feels very different.
Yeah.
It feels very nice.
Good. Excellent. That's what we're hoping for. So again, if it is your sore layer, some ice. If you really need some Tylenol, some ibuprofen, something like that. But it should calm down in the next couple of days and feel a lot better.
Great.
Okay. Dr. Max at Maximal Wellness, teaching practical ways to live a fuller, healthier life.